Hi, everyone. Welcome back to the Resilient Aging Unfiltered podcast. We have an exciting interview today with Dr. Esra Shermadou, and I know I'm going to learn a lot that I will implement in my life. After this, I already know it, so you should all pay close attention because I think you will too. So thank you for joining us.
Yes, thank you so much for having me. I'm excited to be here.
Should I call you Dr. Ezra?
Sure, that works. Whatever you
Okay.
want.
Okay. Great. So I will give the listeners a little bio about you and then we'll jump right in. Dr. Esra Shermadou is a board certified family and obesity medicine physician and founder of Sakinah Health. Did I say that right?
Yep, perfect.
Awesome. In Dayton, Ohio. And she focuses on helping adults improve health and longevity, both physiologically and physically, through evidence based strength training. Yes. Her work bridges modern medicine with movement, emphasizing durability, injury prevention, and long term resilience. Wow, I love that.
Yes. Yes,
That's so
yes.
exciting. Okay, so well, firstly, thank you for what you do. This is so needed and so timely.
Yes, yes, it is very much needed. I think our society is, not heading in the right direction, and we have a chance to turn things around and make things better so people live longer and have a better health span and not just, lifespan. So we're all about that.
Yeah, absolutely. So we'd love to hear what has led you to make strength training so central to your work.
Yes. So it was actually when I was 21 years old, I was diagnosed with cancer. And just from all the chemo regimens that I had to go through, I would just be like bedbound for days after. I just could not get up. And that really just made me crave movement. Like I would just long for the days where I'd
Mm,
start to feel better. And I would get things in the mail from like the Leukemia Lymphoma Society about the runs that they were having. And so I told myself, well, once I'm done with treatment, I'm going to run a marathon. I ran a half, not a full, but we'll take it.
yeah, that's hard.
And then I just started honestly, started doing, like, home workouts because I knew strength training and I knew working out was gonna be important to me, and
Mm,
I started to like it. Before then, I really hadn't worked out, like, regularly at all, never.
wow.
And then my last year of med school, some of my friends were going to the gym, and so I decided to try it out too. And I did a I did a CrossFit class, and from there, I did a few. And then I found the schedule a little bit difficult to maintain with med school and residency, and so I joined a regular gym and got a trainer to learn how to lift weights, and I did that for a little bit, and yeah, the rest is history.
Wow.
Yeah, so I'm super passionate about it, I love it, and I want everybody to try it.
So what was it about it that hooked you so much?
Maybe it was the variety, especially compared to running when I was training for my half. It's a lot of running and mentally it was just, not fun all the
Yeah.
time. And so maybe it was that. I honestly don't know because even at the time, I don't feel like I was like paying attention to the numbers very much or like, oh, I'm gonna lift heavier.
Mm,
I don't know to be honest, but I'm glad I kept it up and now I'm super passionate about it and I'm all about the numbers and trying to get
yeah,
better and all of that. But yeah, it was just
I
I was
love that.
hooked.
Yeah, that's
It was
amazing.
definitely a stress reliever, I will say that for sure. I think it probably took me several months into even my home workouts where I started to really like it, and I
Mhm.
just found it as a major stress reliever, and especially with residency and all of that, it definitely helps a lot.
Yeah, and so I'm trying to, so of course I went to med school and residency also, and I'm trying
Mhm.
to imagine that time in life and
Yeah.
how exhausted you are, and so
Mhm.
you're going to doing these, like, hard workouts where
Mhm.
I mean, it's so much for I think it's a lot easier to run because you can just, like, kinda, like, go slow if you're not,
Yes.
you're gonna lift. I mean, you can't really, like, check out too much, I would think,
Mhm.
and I was just wanting to know, like, would you go and just, like, be in your own world and, like, put it
Uh-huh.
on, like, your earbuds, but or would you just, like there was more, like, of a social aspect that drew you in?
Mhm. For me, I mean, especially in residency, it was I had friends who went to the gym and we would say hi and talk a little bit, but it was mostly
Mhm.
you didn't have time to like waste
Yeah,
around in the gym
consistent,
during
yeah,
residency. It was
true.
like get in, get out. But yeah, And to be at that time, at the same time, I didn't push myself as hard as I do now,
Mhm.
but I would still I mean, I still lifted heavy and people commented on, how heavy I lifted, but I didn't think anything of it. I just thought they were just saying that because
Okay.
I was a Muslim girl, like, lifting, and
Yeah,
so
they were trying to encourage
that's
you
all
to.
I thought. Yeah, and so I was just in there doing my thing, and I followed online programs, and so I think that also helped because it kept me, like, in schedule or on
Mm,
schedule, had a routine to it, and I didn't have to think about it. I would
yeah.
just go in, follow my program, and do my thing, and then just leave, and that helped a lot too, but yeah, I always wonder about it too, to be honest, like, I'm like, how did I, like, get into it? How did I do this? How did I end up here today?
Yeah, well,
Because
yeah. Go ahead.
I was just gonna say, like, because where I'm at right now is, like, now it's like a true, true, true passion, whereas back then, I don't know if it was more of a routine. I mean, I loved it for sure. I absolutely loved it. It was fun, and maybe that was it. Maybe it was just fun. I love to do it, and so
Yeah. It's really helpful, I think, for listeners to hear your story because especially for women, it's
Mhm.
harder to break into that and, like, keep
Yes.
it going and keep the
Mhm.
excitement going, so it's
Yeah.
good to hear, like, that process.
Absolutely, and I knew from my chemo regimen as well, I knew strength training was important for me, and, I had to get DEXA scans and, my one of my first one did show I had some osteopenia
Mhm.
in, my low back and in my I think my left femur or my, left, femoral neck, and so I knew that I had to keep up with strength training, and so that was, like, one thing that kinda pushed me, but honestly, on a day-to-day basis, it wasn't, like, what I was thinking about. I just,
Yeah.
I knew I mean, it was good for health and
Yeah.
for my bones, and I liked it, and
Yeah,
that was
and it's
it.
probably better that you weren't thinking about that on a
Yeah.
day-to-day basis and,
Yes.
like, your identity. That's great. Now you talk about muscle as a key to longevity. So why is muscle so critical for long-term health, not just for strength or for appearance?
Yes. Oh my gosh, for so many reasons. Muscle is probably one of the most protective organs in our body. It helps prevent against so many things. So, number one, it protects against insulin resistance, which is something that especially females are going to experience as we get older and lose estrogen. Insulin resistance increases. And so, muscle actually picks up glucose from your blood. And so, in doing so, it kind of acts like a sponge, like just kind of sucking up all that glucose from your bloodstream, and then that will therefore decrease your blood sugar and decrease your risk of developing diabetes, which can happen. It also decreases our risk of developing dementia as well, and that's very important because if we're going to live longer, we want to be alert, we want to be able to function in life, and so that's important.
How does that work? How does that prevent dementia?
So it decreases the risk. So we know
Mhm.
that with muscle contraction, you have the release of like myokines, which are like signals,
Mhm.
or little like signaling molecules that will then stimulate the release of BDNF, which is
Okay.
one of the neuroprotective
Got it.
neurotrophic like hormones, and so that's
Mhm.
gonna help the development of the neurons and the neuroplasticity, and signaling between them, and so I think that's one of the ways that it's thought to help with that. And I think research with the brain is still definitely, like, ongoing, but
Yeah.
that's just one of
Okay.
the main aspects that they've come up with.
Great. Sorry, I interrupted you because that's
No.
obviously brain centric.
Yeah, yeah, no, definitely,
Keep
no,
going.
I appreciate that.
Are there any other ways that you wanted to share about muscle being so critical for long-term health?
It muscle also, like, helps with our physiological reserve, so if we were to get sick, especially as we get older,
Mm,
our immune system decreases, or maybe we have to have surgery, we might be bedbound for a little bit of time. The more muscle we have, the more that we're able to recover quickly, and that's gonna be very important too, because being bedbound for a long time, especially as we get older, is not a good thing.
wow. Those are all huge.
Yes,
Wow.
yes, yes.
And I wanna say I'm so proud of myself. I don't know if I was channeling you before this interview, but last week I had a patient who he has kind of the beginnings of diabetes and he hasn't been good about no, actually he just got started on insulin and checking his blood
Mm,
sugar and he has memory loss. And so I was like, "Listen,
that's
instead of
hard.
nagging you about checking your blood sugar more, you need to build muscle because he's at the
Yes.
gym, but he's working more on balance." And I was like, "Muscle is your
Ooh,
medicine."
yeah,
And
absolutely, yes.
it's funny the way I
Love
said
it.
it. Like, I was like, flexing my muscles when I said it. But anyway, they were
Nice.
into that, and they liked that.
Yeah.
So,
Yeah,
yeah.
I think and I think it's empowering too, especially for, not only the elderly, but women and honestly anybody. It's very empowering, and one more big one that I forgot to mention with strength training is preventing osteoporosis.
Mhm.
So that's significantly important, especially as we get older, where we might have difficulty with balance, and that's something that I can help with too. But we have that decreased bone density that occurs, especially in females postmenopausally. We have a significant decline in our bone density, and if you fall, you have an increased risk of developing an osteoporotic fracture, and if that fracture happens to be a hip fracture, there's
Mhm.
about 30% increased risk of mortality within the first year. And so those are very significant and scary statistics. And so it's so significant that we all get into it.
Absolutely. If so this is resilient aging. We're trying to
Mhm.
think about
Yes.
specifically as we get older. What what about timing of starting? So say you haven't been into strength training or building your muscles throughout your life. What changes when someone begins lifting in their 40s, 50s, 60s, or older?
Mhm. Yeah, so, you can build muscle at any age. And so if you're starting in your 40, 50, 60, 70, you're going to build muscle and you're going to just gain the benefits from doing so. So not only the muscle mass that you will build, but also the improvement in your balance, and all of that is going to correlate to your everyday life. So you'll notice that you're able to walk better, maybe a little bit faster. Getting up out of chairs or getting up off of the toilet is not going to be as difficult. You're going to be able to, you need to be able to not only when you get up, most people use their hands to get up. And so if you don't have any strength in your upper body, you're not going to be able to get up on your own either. And so you will notice improvements in all of your physical fitness and be able to function in daily life. But then also those improvements that we get with the insulin resistance in the body, the joints, making our joints stronger. And
Mhm.
you might even notice a decrease. And a lot of people complain about, pain in their joints, and that's why they can't exercise. But actually, if you do so properly and don't just go from 0 to 100,
Mhm.
overnight, you'll actually notice an improvement in the joint pain. And that's, again, going to be able to allow you to function better, walk even, better, and do so walk more frequently, as well, without being in pain. So a lot of benefits that come with it, no matter what age you start with.
Okay, that's great. So how I get asked this sometimes, I'm sure you do. So
Mhm.
and going along with what you said. So how do you know when if you're experiencing pain when you're lifting, if it's time to stop or you just push through it or does it just case
Yeah.
by case?
Yeah, so pain is never good. You'll know when if it's an ouch pain, like, yeah, stop. If something doesn't feel good, stop and reassess, to pull things back a little bit, maybe go back to the weight that you were doing previously, or if it's a weird movement that maybe it's a new movement,
Mhm.
get somebody to help you out and see, are you doing it right or not? Because, lifting weights should not be painful. You can be sore the day after, and that's fine, or a couple
Mhm.
days after, because your muscles are just kind of getting used to the new stimulus, the new movement. But pain is not good. We don't wanna be in pain.
Okay, but soreness, that's to be expected.
Mhm. Yes, yes.
Great. So, how do you incorporate this talking about strength training and building muscle in your medical practice? Or
Yes, this
not just talk about, but how do you
Mhm.
work with
Help
patients on
people. Yeah, definitely. So you have to meet people where they're at. If somebody is not even able to walk or do basic movements, like, start with that. Like, maybe 10 minutes after each meal. That's going to be great. Like, can we do that? Or maybe it's just an evening walk with your friends or with your family. Find a buddy that's going to help increase the chance that you're going to keep up with something. But find something that they're comfortable doing. Or maybe they like to dance dance at home, and that's fine too.
Mhm.
So finding I think that's number one thing, is just getting
Like
people comfortable
moving.
with moving
Yeah.
their bodies. And then from there, we can build into body weight exercises. So I always
Mhm.
kind of show, like, body weight squats. So whether it's just sitting up and down from a chair multiple times, like we do every day, assisted push-ups against the wall or against the counter and working your way down, is another big one. Those are probably the two that I probably show in the office every day. The two that I start with.
Mhm. Okay. So, do people come to you? They're drawn to you because of that. They want that to become a more important part of their life.
I think people primarily come for 2 types. One will come for weight loss because they want to lose weight, and then in that, though, we can lose weight in an unhealthy way, and we're gonna end up very unhealthy in the end, and we're gonna,
Mhm.
not able to move, we're gonna have low muscle mass, and that itself is gonna increase our risk of mortality. So, that's something that
Mhm.
I talk about. It's like, why do we wanna lose weight, And when we do so,
Mhm.
we need to do so in a healthy manner, so we focus on, like, nutrition, strength training, of course, movement. Another group will come for hormonal support, and when you really dig into that, a lot of times it can be because they feel like they're not building muscle like they used to, especially for the males, or for females, they're getting that, that central belly fat that occurs around menopause. And so they think that, if I start on hormones, then I'm going to be able to lose this belly fat or get this muscle. And then it's, talking to them, okay, it's not going to just disappear on its own with taking hormones. We need to
Mhm.
incorporate nutrition, strength training, even, sprint training, so including both aerobic and strength training with it, that's both important, for, improving our health. So, yeah.
So when you're getting into that like midlife for men or women and you're like
Mhm,
that is shifting where it is on your body, what's realistic expectations if you are committed to strength training and other things, but
mhm.
what your body can look
Yeah, and I think that's the thing about, obesity is it's so multifactorial, and that's what we're still learning a lot about it. So we know,
yeah.
genetics can play up to 40 to 70% role in obesity, and so that can also determine where you store your belly fat. So we know that there is an increased shift, especially for the females, into the belly area, but part of that can also be genetic. And so you kind of have to, you'll definitely see an improvement if you focus on your nutrition, strength
Mhm.
training, and we know that with especially specifically with the belly fat area, high intensity interval training tends to target that area really well as well. So just short spurts a couple times a week will help with that. And so you'll definitely see some improvement. You'll see an improvement in your tone and in the shape of your body for sure. And then depending on how much fat you have to lose, you'll see obviously an improvement with that as well too. But part of that is going to be also based on your genetics too.
I see. And you said 40 to 70%?
Mhm. Yeah.
Wow, that's a lot.
Mhm.
Well,
It
that's helpful
is.
to know. Then you can,
Yeah.
not be so hard on yourself if
Yeah,
yeah.
exactly,
Okay.
exactly, but I think once people also get started with the process and, it takes a few months to get into something new, and then once you start, you know, pushing the weights as well and being more comfortable with it, you get that confidence in you as well, and that goes with you in other aspects of your life too. Your family will notice it, and so sometimes you'll see the shift going from just focusing on your body and how you look to focusing on strength and seeing what you're capable of doing in everyday life. Like I can run up the stairs, to the second floor without getting short of breath. I
Mhm.
walk from the parking lot to the store without getting short of breath. I don't have to lean on the cart when I'm going grocery shopping. So I think you start to see those everyday things and that becomes a win as well.
Yeah, that's huge.
Yeah.
I'd love to hear more about your medical practice and when you decided to shift from the tradition or more about your
Mhm.
practice and shifting outside of the traditional
Yeah.
healthcare. Yeah, and what the philosophy of your practice is.
So for me, the strength training and nutrition was always something that I just loved personally, and it was always something I was something looking up and just applying to myself and learning for myself. I actually did ER right after residency. So I did that for a few years and I just started to see how much of a factor obesity played in the patients that we see every day. A lot of times patients come in, they're bedbound, they can't get up from the floor if they fall. EMS brings them in, or with COVID, just seeing a lot of the effect that obesity had in patients who would come in with COVID and like their breathing was significantly worse than those who were not obese and not just with the obesity but other factors as well too, like the weakness, people just not being able to function, the fractures, all of that. And day after day, for a few years, it was just it was a lot. And I think that kind of reminded me of why I went into medicine in the first place, was helping people live healthier, better lives. And, I think a lot of times many people want to go into medicine for that reason. And then quickly we're kind of thrown into the system and it just, we're just doing a routine, same thing over and over again, medications, treatment, but really wanting to prevent diseases and help people live better lives, healthier lives. All right. So yeah, it was my experience in the ER that really prompted me to consider opening my own practice. I saw the effects that obesity had on many conditions that people would come in with. So whether it was, heart disease or, respiratory illnesses, fractures, so many things that were affected by obesity and frailty in general. And that really opened my eyes to see that how unhealthy our population was and things are not getting better. And so that really brought me back to the reason why I got into medicine to begin with, was to help people live healthier lives. And so I think that comes back to the basis of, our day-to-day lives. So, our food, our nutrition, movement, stress management, community, all of that plays a role in, our health. And so that really prompted me to open my own practice and really focus on these main things. Of course, we now know that obesity is multifactorial, and we have these medications that can help assist with people who have tried to lose weight on their own, many, many times by themselves unsuccessfully. And so we have tools to help us. We have hormone replacement that also affects our longevity too in males and females. And so we have these other tools that we can use to further promote a healthier lifestyle. And so that's, I'm very passionate about people living healthier lives where our lifespan is increasing, but our health span is not. And so we have the opportunity to change that. And so that's what, drives me to show up for my patients every day.
Okay. And so you're great. I love that. And your practice, so it offers more time and space for you to focus on those things.
Correct. Yeah. So because I do not take insurance, I'm able to spend a lot more time with patients and really giving them what they need and not necessarily what, a third party is telling us that we need to do first. And so I'm really able to spend a lot of time with them and catering their health plan to them, because not everybody is going to follow a cookie cutter plan. Everybody needs, some people might come in needing help with nutrition a lot more than others. And, so I'm able to personalize care a lot more. And I think that's what makes it successful.
Yeah, definitely. That sounds awesome. Um, I wish that existed for in the traditional healthcare system, right?
Yes.
Someday, who knows?
One day. Yes.
Yeah. So, can you speak to nutrition? Uh,
Hmm.
I would just want to say for my practice and in brain health, it hasn't been clear, and they're
Yes.
still saying the Mediterranean diet or
Hmm.
anti-inflammatory diet.
Yes.
Yeah. So I'd love to hear how you approach that.
Yeah. So for me, number one is protein. I stress the importance of getting protein in because that's what we need to build muscle, and muscle is what we need for longevity. So I always say, like, you can't build a house without bricks. So you can't build muscle without protein. And then number two, fiber. Fiber, we're learning more and more about the connection of the gut to other aspects of our brain, our decreasing risk of cancer, mental health, all of that. We're learning more and more about the gut. So fiber plays a big role in it. So making sure people are getting enough fiber, in whole grains. I don't specify, and you have to have so many, don't eat carbs or don't eat this, and I'm all about like the 80/20 rule. If that's what works best for your lifestyle, we want something that's going to be sustainable. And so if, 80/20 rule works, like, let's do that. And again, that takes a lot of, it's a lot of change for a lot of people, especially compared to the standard American diet. And so it's just, I start with one thing. Okay. Can we get protein in, or can we just focus on getting more veggies in? What are they willing to work with? Those are my big things: is protein, fiber, whole foods is kind of where I start with.
That's very clear.
Yes.
And for people who are vegetarians,
Hmm.
what do you recommend for their protein?
Yes. That definitely, I tell them it's going to be a little bit harder, to get pure protein, but, if they are open to things like tofu, and, whether or not they eat fish or egg whites, everybody's a little bit different, or eggs in general. So those are sources. Lentils, beans, of course, are good sources as well. And then, protein powders as well as a supplement, are kind of my main things that I talk
Great.
about.
That's so
Hmm.
helpful.
Yes.
And so seems like everyone's taking creatine now.
Oh, yes.
Is that what they should be doing?
Yes, I definitely recommend that, to people. The 5 grams is kind of the standard, dose for everybody. For some people, it does cause some GI, side effects like bloating, and so sometimes we start at a little bit of a lower dose. That's not the first thing that I'm going to jump into first. Tell them that they have to start taking. We work on the other things first. if they're asking for supplements, I definitely recommend it. And there's, a lot of research coming out with brain health as well too.
Mhm.
I think the dose in the studies was quite higher when I last looked at it, like 20 to 30 grams, and
Oh,
so that's a hefty amount.
very different. Yeah.
Yes, it is, and so that's a lot to take in one day. I haven't looked to see if there's been any updated studies about it, but, from when I looked, it was like it was a great deal. I have heard some people anecdotally say that if you take, 10 grams at one time,
Mhm.
especially after a night of not sleeping very well, they notice improvement in cognition, and just kind of feeling more alert. I've tried that. Personally, I didn't notice anything, but
Okay.
for some people, it's worked, so
Okay. I might try that.
if you can tolerate it GI-wise, why not?
Yeah, it's safer than a lot of other things.
Oh, yeah, yes. One ingredient, so,
Yeah.
don't have to worry about the other things in it.
Yeah. And then I always say, and you can add whatever onto this, but just to look for listeners, like always get third party tested products for
Yes,
supplements.
absolutely.
Anything else people should
Yep.
keep up.
Yeah. Yeah, I always say, like, try to look for something, of course, third party tested, the fewer the ingredients. So if you're looking at protein powders, a lot of those can have a lot of additives in them.
Mhm.
So just minimizing them or just looking for something that is, a brand that focuses on cleaner ingredients. Of course, nothing is FDA approved or tested. You just kind of have to do your own research and see how it makes you feel and what you're
Yeah.
comfortable taking.
Okay. That's helpful. So, and maybe gearing this towards those of us as we age, what
Mhm.
simple tests or signs can help someone gauge their physical resilience right now?
Yeah, that's a good question. So, grip strength is a big one, especially now. And, the reason for that is that it's a quick way almost to test your overall strength in your body. So, the overall muscle mass that you have in your body. And we know that muscle mass is tied with cognition. So, the more muscle mass that you have, the decreased risk of, dementia that you have. And so, that's a quick way to test it. The sit to stand test as well. So, how many times you can go from sitting to standing unassisted and kind of keeping your hands up, not necessarily using the armchairs to support you.
Mhm.
That is another also a great way to test your resilience and even just walking. Can you walk with a decent amount of speed and not being off balance? So those are
Okay.
probably the three quick tests that you can assess your resilience.
Sweet. I love that. And you know what?
Yes.
I just started incorporating those into my brain tune up initial evaluation. Those,
Nice. That's
heck,
awesome. Very important.
yeah, awesome.
Yes.
Um, so do you give patients like a movement prescription, or how do you work that?
So I see what their comfort level is like, and that is something that I do try to do.
Mhm.
Sometimes they're a little bit more hesitant. They're just like, and they're like, well, I do my own thing, and that's fine. But I do also have like an in-body scan in my office, and so I'm able to assess their muscle
Mhm.
mass over time, which is helpful. And it kind of sometimes gives patients like a view like, oh, maybe what I'm doing is not. Maybe I need to change things up a little bit. And so I kind of worked I try to do that in the beginning, and sometimes they're agreeable to it, other
Mhm.
times they're just like, a little hesitant,
Yeah.
so I just meet them where they are, but
Yeah.
I definitely recommend it if people are up to it, for sure.
Yeah.
And it doesn't have to be anything crazy, like, just start with 2 simple movements and
Mhm.
go from there.
Love that. Yeah, I could see how you don't wanna discourage people because certain
Mhm.
people view that, and if they can't do it, they're
Yes.
failing, or, they're not getting the A
Yeah.
plus, and, like, that
Mhm.
could be,
Yes.
discouraging and
Especially when
demoralizing.
you're starting off with them, until you develop that relationship with them. Yeah. We take things one at a time.
Yeah, totally. Awesome. So if someone listening, I think this might be one of my last questions, wants to build a more resilient body and brain over the next decade, what's the
Mhm.
mindset shift they need to first make?
Yes. So I think a lot of people wait for motivation. And
Mm,
I think you need to focus on your why. Like, why are you doing this? And use that as your kind of your key driver in your own motivation because motivation comes and goes. I'm not motivated to go to the gym every day. I'm tired sometimes after work, but
Yeah.
I know I'm going to feel significantly better afterwards. And or I'll just tell myself, okay, go in and give yourself 15 minutes, 10 minutes, see how you feel. Maybe you just lighten up a little bit that day. Your body doesn't know, it doesn't, your brain doesn't recognize numbers. So it doesn't recognize, oh, you're lifting, like 90 pounds today instead of,
Mm.
100. Your brain doesn't know that. It just knows the perceived effort. And so just kind of go listen and see what your body feels like or what it's doing. And maybe it tells you go home, but don't wait on motivation because if you are, you could wait years and years and years
Wow,
before. So that's kind of my big one.
that's brilliant. I love that.
Yes.
And I think about just keeping that routine going
No, yeah,
is
100%.
is so crucial.
Mhm.
And
Yes,
and
because
we
I think, like I said, like, it took me months before I really, like, enjoyed, like, strength training or even just exercising. It took me months. I mean, I was doing it in my small bedroom, at home, for years, and so but it took me a while to really enjoy it, but it's putting in the reps. That's where motivation comes from, is putting in the reps. So just doing a routine and, just start with if you're not doing anything, start with, once a week. Move it up to twice a week, at least 2 weeks or 2 days a week of full body movements, focusing on your big muscle groups. So your back, your chest, your legs. That's, what is recommended as far as the baseline. If you do a little bit more, that's even better. You can focus on more muscles, but at least twice a week, if we can get that in, like you're up for success.
Yay, I love that.
Yes.
Great. And then
Mhm.
I just, I think my last thing, I want to acknowledge you sharing about having cancer in your 20s
Mhm.
and like, wow, what a powerful
Thank
experience.
you.
And, really, I wanted to highlight how you had that awareness of what you were missing. And then you
Mhm.
just turned that into a major growth and transformation that has now impacted your whole
Yes.
career. So
Oh
that's,
my gosh,
wow,
yes.
that's so inspiring.
Thank you.
Yeah.
Thank
Cool.
you. Mhm.
Yay. Well, can you tell the audience how they can find you?
Yes. So my practice is located in Dayton, Ohio, Sakinah Health. And otherwise, I am on all social media platforms. So Instagram, Facebook, TikTok, and YouTube under Dr. Esra Shermadou. And you can find me there.
Wonderful. Yay. Well, thank you so much for being here.
Yes. Thank you so much for having me. This was wonderful. I absolutely loved it.
So inspiring. And
Thank
I
you.
am gonna go focus on lifting stronger weights and
Yes.
not just kind of going along, but really
Moving weights. Yes.
yeah.
Yes.
Excellent. All right.
Love it.
Hey. Well, thank you again, listeners, for tuning into the Resilient Aging Unfiltered podcast. Please like, subscribe, rate, and review, and come find me at mybrainlove.com and reach out if you want to learn about becoming a patient. I think Dr. Ezra and I share similar, I'd say, holistic mindset.
Yes.
So it's great. Great to
Mhm.
know what you're doing. And best of luck and hope to have you
Thank
back.
you. Yes, absolutely. Thank you for having me.
Okay, great.